Hello, everybody. Thank you so much for joining us today. My name is Ann Flenner. I am the current past president of the Florida Counseling Association, and today we are doing something different that we don't always do. We're doing a webinar, really reaching out to our families. The Florida Counseling Association is a professional organization for counselors, mostly focusing on professional development for counselors across the state, but today we really wanted to focus on our community. We wanted to be out there to help our families, especially with the tragedy at Parkland. We want our parents to be ready and able to talk with their families and their kids and being able to process this event. I wanted to introduce our very important and special presenters today. We are so lucky and blessed to have them with us that are going to walk us through this important information. Mrs. Irene Rodriguez and Miss Luna Medina Wolf. I'm going to give them a short introduction about how wonderful these women are, and you'll see how much wealth of knowledge that we are going to have at our fingertips today. So Irene is the founder and director of Mindful Journey Center. She's a licensed mental health counselor, a certified addictions professional, and a certified clinical trauma professional with a Master's of Science in Mental Health Counseling from Nova Southeastern University. She is certified EMDR therapist and a certified traumatic incident reduction facilitator and trainer. Mrs. Rodriguez has been trained in trauma-focused CBT, life stress reduction, and is certified dancing mindfulness facilitator and trainer. Professionally, she has worked in a variety of populations with a specialty in treating children, adolescents, and adults with complex issues such as depression, PTSD, cutting and self-harm behaviors, anxiety, anger management, adjustment disorders, addiction disorders, substance abuse, grief, phobias, dual diagnosis, and mood disorders such as bipolar since 2006. So there's really nothing this woman can't handle with our wonderful families and clients that are sent her way. And just to the side of her is another amazing woman, Miss Luna Medina Wolf, who is also a licensed mental health counselor who works with individuals, couples, and families experiencing different obstacles that can cause high levels of emotional pain and anxiety. Some negative experiences arise from the ineffective communication skills, substance abuse, trauma, school problems, and others, and Miss Medina Wolf is ready and willing to help anyone who needs that assistance with those obstacles in life. She is a certified rehab counselor, a master certified addictions professional, and she has a strong background in working with individuals who are struggling with substance abuse and who have experienced trauma, and also those with disabilities. The love she has for her career and the compassion that she has for her clients really makes her the most effective therapist. And she, in addition to this, serves as the Florida Counseling Association secretary, is a member of ACA and AMCA, and is always learning to best meet her clients. So we are grateful to have these two amazing professional counselors with us today. And without further ado, I will send it on over to them. Ladies, it's all yours.
Thank you, Anne.
Thank you. Thank you.
Amazing introduction.
Okay, so we would like just to start doing kind of a grounded exercise. Today's webinar is more focused about trauma, how to cope with trauma. And one of the basic techniques is like feeling grounded, be present, be mindful in whatever is happening here and now. So if this is possible for you guys, I would like you guys to sit, if you are seated, or just stand up if you are stand up, and just notice. Maybe you may need to take a deep breath in, hold it for a while, and just let it out. Just allow yourself to be present. And sometimes that is difficult because our mind just wander all the time, and that's fine. Just notice any thoughts and just let it go without entertaining the thought. Okay, maybe you need just to look around, try to identify objects. Perhaps I hear here the light, I see a plant over there, I have a frame. Just noticing the space. Or perhaps you may need to identify any sound, what you are hearing at this moment. Could be my voice, hopefully. Maybe the traffic, maybe some music, depending on where you are. Now bring attention to your taste, your mouth. Notice any taste, any sensation. And then just keep noticing without any judgment, just making space to whatever is happening, to whatever you are feeling this moment. And sometimes we are not used to being silent, just being still. And when we are working with trauma, with stress, that is sometimes the only thing that we need, just to pay attention to our breath, just to quiet our mind. So take a deep breath in, let it out. One more time in, let it out. And for this last one, take a deep breath in and let it out with a huge something that I teach to my clients, just kind of stretching, feeling that sensation, your muscles stretching, because sometimes we forget about that, okay? You need to check any tension that you may have, shake it. And just this beginning as a opening for this training, okay? So now Rune is going to continue.
Okay, thank you. There you go. So what we're going to cover today, what we're hoping to get out of this training, what you are going to get out of this training, is for us to be able to define a traumatic event for you, to discuss the traumatized brain and what it means, to list at least 3 trauma-related symptoms or more, and discuss also coping skills to deal with the aftermath of a trauma. We're going to actually cover multiple techniques and treatment techniques and different techniques to help you deal with the trauma, you as a parent and for your children, because trauma definitely affects us. It affects everybody in different ways, but we have to make sure that we take care of our bodies and our minds after something like that happens. Then we're going to recognize helpful ways to support your children after the experience, and there's going to be a little bit more resources at the end. So we're going to start with the definition of trauma. The word trauma actually originated from the Greek term for wound. Trauma is an event that affects an overall person, meaning it affects us in all different ways. It may affect how we view ourselves, it might affect how we view others, the world, it may affect our sense of security, the way we think, the way we act, our ability to function on a daily basis. And again, because this is very individualized, Irene and I may experience the same event, go through the same car accident, God forbid, and at the end of the impact, even so it was immediate impact on the front for both of us, I may react in a very calm and controlled manner, and Irene may scream and shout and not be able to drive for months and months after. Everybody's different, so everybody's going to experience that differently. Trauma can be defined as any incident that has a negative physical or emotional impact on the individual. This is, like I said, is a subjective issue, and it could be perceived differently by different people. We added just a very quick definition also about the state of crisis, which is basically the instability and state of dangers, and it causes stressful emotional response to whatever is happening and may have significant effect on the person's life after. Right, anything else to add? Good. Okay. The possible immediate effects of trauma can affect changes in daily routines. There might be a need for decreased social contact. There may be changes in personal identity, so that relates to what I mentioned before. You know, how I feel about myself, how I feel about other people around me. It may change the way of my safety. Am I safe where I am? Can I go back to where I used to be? Can I go back to the example about the accident? Can I go back on the road? Can I trust other people on the road? Can I trust myself on the road? All those things can be a result of what happened to us. And it goes back to changing person's beliefs, values, the roles and functions. A lot of people just find it very difficult to go back to their daily routine, to be able to function as they used to function, especially because of some of the symptoms they may experience after. Feeling of anxiety, fear, worry, again, the sense of safety, fears about other violent incidents that may occur. Going back to how am I going to be able to feel safe again in this world? This is a huge thing that for a lot of people happen, and it's important to discuss.
And I would like to go back to the definition, the root of the word trauma, and it's wound. And we were talking when we were preparing the presentation that kind of the analogy that emotional wound is kind of similar to the physical wound. So if I cut myself as an accident, I can see the wound, but with emotional trauma, we don't see it. It's invisible, okay? We can't even explain it. Sometimes there are no words that we can explain it. So sometimes because we don't see the wound, we kind of minimize and we don't give the attention that we may need. So if we can kind of keep in mind that analogy, wound, trauma, emotional trauma, wound, like having that, we need attention. And sometimes we just need kind of a hug. Sometimes we just need someone to listen to us. But there are times that we really need to have a specific technique, a specific training, in the same way that when we get in a physical accident, we need a specific treatment intervention. So if we keep that in mind, maybe it's easier to understand how sometimes we get triggered, how sometimes we try to avoid talking about things that happen. It's because it's painful. The same way, if I break my finger, if I touch it, it's going to be pain. It's the same with emotional wounds.
Okay, thank you. Okay, so we're going to go into a little bit of details about the common reactions to trauma. And the reactions can last anywhere from a few days to a few months. And it really depends on how we perceive the event and the magnitude of the events. There are many layers as to why a reaction will come to the trauma. The body doesn't shut off, and that's the most significant thing that we have to pay attention to. For a lot of people who experience trauma, depending on their reaction that they had to it, so if it's freeze or run away or act upon something, then most likely we're going to continue in that mode because we're going to be fixated on that mode. So people who experience it first as a shock, they may be in a state of shock for a while. Everybody's different. So somebody can be in a shock for a day or two, and somebody can go from a shock to a state of denial, and then they may not even allow themselves to process what happened, which is kind of like what Irene said. It's, oh, it hurts, so I'm not gonna talk about it. I'm just gonna kind of like compartmentalize it and not think about it further because it's too painful to think about it. So some of the changes in behavior that you may notice as parents in your children is increased in activity level or decreased in activity level, decrease in concentration and attention, maybe increased in irritability and anger, sadness, grief or withdrawal, some radical changes in attitudes or expectations for the future. And again, I want to make sure that you understand that in the beginning stages of a trauma, of course, some of those reactions are normal and predictable, and it's totally okay if it lasts for some time. And again, you have to assess it as a whole, not if my son, my daughter is all of a sudden having more anxiety, so something is wrong with them. Doesn't mean that something is wrong. It means that they still need to process what happened. And they may not even be aware that that's what needs to happen. For them, they're just like, I'm anxious. They're affected by the trauma without understanding really what is going on in their brain. And I'm going to go into that a little bit more in details in a few slides. So again, if all of a sudden your child begin engaging in some harmful behavior, like drinking or using drugs or just doing things that are harmful to themselves or others, all those things that they didn't do before, then definitely that's something to really pay attention to. Make sure that you bring it to their attention and your attention and having a discussion about it. That's very, very important.
Yeah, I want to add to
Sure.
what you are saying is that those behaviors, even those seems to be no adaptive, is the way that they have to cope with whatever is happening. So when we are working with through the trauma lens, okay, as a clinician, we see the client, in this case the child, this adult, not looking for things that are wrong with them, but things that had happened to them. So it's totally kind of change of paradigm mostly. So we are not trying to see what is not working, it's how you've been coping that now is not working with you or for this person. So those symptoms that Luna just mentioned is just the way that they've been using to cope with whatever happened. Some of the common thing is very common to see, especially teens that start to cutting themselves. Is that because the trauma, they get numb. Okay, so cutting is the way that they start to feel, at least. Or the sensation, the emotion is so painful that then cutting, they kind of translate that to the physical pain. So even though it's like, oh my God, what is happening? Of course, they need attention, but it's just a reaction of what happened to them.
And we have to remember that after trauma, it means that during the trauma, a lot of cortisol level is being released in the body as far as the chemical thing that happen in our body. And as a result of that, we may be hyperactive, and that's why there's an increase in activity level. We are flushed with all those hormones in our body that cause us to be hyper alert. Therefore, we may have issues with sleeping. Not sleeping may cause irritation, and so forth. All those behaviors like hypervigilance, maybe the decreased sleep that we mentioned is very significant. And I think I have a few more here. So physical complaints definitely are something that also appear. Headaches, stomach aches, all this body sensations, because we know that the mind-body connection, there's definitely a relationship between the two, and you have to pay attention to make sure you take care of yourself when that. Changes in school and work habits after an incident, staying focused. Some people may stay focused on the event. They will continue talking about it. That's their way of coping with it. Others may do exactly the opposite. The strong reaction to the reminders of the attack, so those are really important, because we're going to talk a little bit further down the presentation about what you can do as parents, which relate to that. To paying attention to a sound that maybe happened during the incident, and you have to, as much as possible, avoid having those sounds around your children after the event. That's, you know, a lot of the media images and what happens. We want to stay informed, which is understandable, but as much as possible, if we can limit some of that, we're going to talk a little bit more about that down the road. And then, of course, like I said, increased sensitivity to sounds. Do you want to add anything?
Yeah, what you just mentioned is the triggers. People play the things that may have like common themes, similarities to the traumatic event. Okay, so maybe it's the ambulance sounds, or the police, or even a smell. So sometimes the kid is going to react or overreact to something, and we don't know why it's overreacting. So we have to pay attention, or be mindful, and also kind of validating that maybe that reaction is because of something being activated as a trigger. Okay, so because of that, is also very important to get knowledge what is going to happen, what is happening, or may happen as well. Maybe your child is totally fine now, and 2-3 months from now, you may start to see the symptoms. Okay, so the child is like oppositional or defiant. Okay, we have to take in mind the thing had happened.
Definitely.
So we can provide the correct treatment and the correct support.
And to piggyback on that, the way I kind of like explain people who come to me for trauma treatment, I explain it in a very simple way, in the sense that if you experience a trauma, and during their trauma, going back to the 5 senses and how our subconscious mind picks up on that information. So if we go back to the example that I gave about Irene and I got today going through a car accident. So during that car accident, let's say there was a nearby pizza place that just took out something, and I picked up the scent of pizza. So it could be that my brain, because during trauma, the brain processes information in a very way, then my brain is now linking our car accident to the smell of pizza. Next time I may smell the smell of pizza, and all of a sudden I am going to be flushed with all the emotions back to the accident and what happened to us. I'm not going to understand why am I freaking out about the smell of pizza. I'm going to have no idea as to why is it happening. And that goes back to the explanation of trauma in terms of layers. And the human brain is actually able to infinitely make connections between events and things that happen to us. So if I smell the smell of pizza now during the accident, and I'm having a reaction to it, and then in 4 months I'm going somewhere, I smell the smell of pizza, and during that time my brain picks up on 3 things that I see around the room. Now my brain being linked to the initial incident that happened during the accident, to the smell of pizza, to the 3 things I'm noticing around the room, like the picture hanging, the glass of water, and the computer screen. And now all those 4 things are linked to my trauma. And when I say infinitely, I mean infinitely. Yeah. So
it's a network. It's the whole trauma network, where things get connected by theme and similarities.
Yes. By theme, by similarity, and the 5 senses play a very huge role in all that connections that are created. Okay.
Absolutely.
Anything else?
No, it's fine.
Okay. So let's talk a little bit about trauma in the brain in a more biological way. In general, just so you know, approximately about 50% of people are going to experience some kind of traumatic event at some point of their life. And I think we forgot to mention a little bit on the beginning, because a lot of people come in and say, what is trauma? Just in simple terms. And I say to a lot of my clients, I say, actually, if you have a memory from 1st grade and you had a huge fight with your best friend, and you may be even 45 years old today or even more, but when you think about that memory, it makes you kind of go like, ugh, I don't want to think about that. Meaning there's this negative emotional reaction to what happened. That's, to me, a trauma. It may be a little T, so a little trauma, comparing to a big T, which could be a more significant threatening event. But still, this is all relating to what we perceive as a traumatic event. So due to trauma, the brain actually changes. And during the teen years and childhood years, it becomes even more significant, because those are very important years in development and what happens in our brain development. It's very significant to make sure that the brain receives the healing that it needs in order for the brain to change back to normalcy, to change back to right development. So it's not going to be damaged, and it's going to be irreversible damage if it's not going to be treated. What's beautiful about the brain is that it's plastic, meaning just like it can change for the negative, it can change back to the positive. But you definitely have to make sure that you get treatment for trauma, because sometimes people experience an event of childhood that defines their way of seeing the world as dangerous because of what happened to them. If they don't work on changing those beliefs and the way they see the world, they're going to live the rest of their life as thinking the world is dangerous. And that's going to have significant events on how they interact with other people, how they interact with themselves, how they interact with the world as a whole. So this is very important component. The trauma affects three main areas in the brain, which is the prefrontal cortex, which is the thinking center. So if you think about the thinking center, this is more of making decisions and thinking clearly about making decisions and just being able to function and in daily living, like personality, planning, empathy, awareness, all those relate within the thinking center.
And we can, and even though we have the picture on the right, and this is right of the screen, we can use also the hand motor. Okay, so the part that Anduna is saying, if we use our hand as a brain here, the rational part Okay, the thinking center is this one. Okay, what happens is when trauma happens, it's not thought processing. This part then get blocked by the emergency. That is what the one that you're going to explain now.
Right. So the anterior cingulate cortex, the ACC, meaning the emotional regulation center, this is where we regulate our emotions. So it defines how we interact with other people and how we respond, in what way are we going to respond to what is happening to us. That's what's going to be activated during that time.
So this is the rational part, the prefrontal cortex, and this is the amygdala, is where the emergency system get activated when we feel in danger.
Right.
Okay, what happens is during trauma that the logic, the thinking process, get blocked out of the way by the emergency system. In this case, is the amygdala. Okay, so because this part get blocked, the communication is not completed. The communication process get blocked. So imagine that this is kind of a bridge. Okay, so it's a gap between thinking and feeling. Okay, because there are times that we know that we shouldn't do things, we know better, but still we keep doing the same behavior. Okay, it's because then this center, the amygdala, is taking control. Okay, we are not aware of what is happening.
Yeah, the amygdala is almost like a receiving center. We receive the information, and then it's supposed to say, okay, is this a threat? Are we in a condition of threat? So in case that we're being attacked or anything, the fight or flight response or freeze. So people may, again, go back to what I talked earlier, people may get stuck in that mode and they're not going to be able to really regulate their emotion. They may hyper, and I think the next slide talks a little bit about the hyper. Yes. So the three main areas there are different with a traumatized brain. So once you go through a trauma, the trauma now changed your brain. So now it is a traumatized brain. Everything is going to be viewed through the eyes of a traumatized brain. Everything is going to be experienced through the traumatized brain. The thinking center is going to be hyperactive. So it's going to be underactivated. This may cause issues with concentration, with attention. At times it's going to be feeling as if you can't think clearly. You're going to feel like your head is so full with information that you don't even know how to react. And it's also like a feeling of like, am I going crazy? What is happening to me? And that's why it's so important to understand those processes, because it kind of like gives you the permission to know, okay, it's normal that I can't think clearly right now. This is okay that I can't concentrate. It's okay that I have difficulty focusing on my attention on one thing or the other. This is all the responses that are happening due to this traumatizing incident. The emotional regulation center is hypoactivated as well, which means that we may have difficulty managing and handling our emotions. So we may be super reactive to situations and may start crying all of a sudden, or we may feel numb. We are going to have a flow of emotion and very fluctuating emotions to all different types of emotions. And the fear center is hyperactive. So we're overactive in that area, the amygdala, which means that you may have really hard time feeling safe, calming yourself down, falling asleep, staying asleep. You may have flashbacks from the trauma. There may be significant, even not during sleeping, you may all the time have a flashback or a trigger like we talked earlier. You may have something that you had no idea that is linked to your trauma. All of a sudden you run into it again, and then you're going to be fully activated because your brain is going to think, oh my God, it's happening again. So you're going to act to it. Anything else?
Yeah, because the thing that you just explained is so important to practice mindfulness, to practice meditation, to practice just be aware of your breath. Okay, because in that way, yes, something happened, and yes, we may be hyperactive and very like reactive, but we can also train our brain to then be calm and be present. but that have to be through intention. So we have to make the time just to practice mindfulness meditation, and we are going to talk about that at the next 2 sessions we are going to part of the training.
Yes, we're just going to talk right now a little bit about some of the common treatment modalities for treatment of trauma. I'm going to cover today only 2.5 treatment. I'm going to mention a few others just because we don't have all the time in the world. I wanted to mention the most helpful techniques that I and Irene ran into. The first one that I'm going to mention is EMDR, which some of you may have heard about it. EMDR is amazing because it's based on the theory that painful memories remain unprocessed in our memory system. So going back to the definition of trauma and how trauma is stored in fragments. So it's not a storyline. Like if I want to tell Irene what I did yesterday, I went to the park with my kids and this is what we did. It's a storyline. I can remember the beginning, the middle, and the end. When there's a trauma, a lot of the time, we're going to have difficulty remembering the beginning, the middle, and the end. It's going to be, oh, I remember this, and this, and this, and then we may forget this, and then it's going to come back to us later. All those things create kind of like a little bit of a mess in our brain. And that's why the triggers are so significant, because again, the amygdala is hyperactive. We don't have a full storyline. Everything can kind of like create a reminder of what has happened. It's basically it stands for eye movement desensitization and reprocessing. It's a big name. It stands for the fact that we do bilateral stimulation. By doing bilateral stimulation in the brain, we help our brain create a form of a storyline. So restore the memory in an adaptive way, helping us make connection between all those effects using the 5 senses. Using all those through the bilateral stimulation helps us store the memory again in the brain in an adaptive way, so it's not going to have the emotional connection and all the negative emotions that provoke due to the negative event that has happened. Different practitioners use different modalities as to how to do it. It used to be some people use the eye movement, some people use light, some people use sound, some people use tappers. Everybody is different. What's really important is that it has an extensive amount of research behind it. It is used by the Veteran Affairs Office to treat veterans who came back from combat. It's significantly efficient and short-term. And actually, within EMDR, there's an early intervention technique that I just want to mention quickly here, which is called the RTAP and the GTAP. So for RTAP, it's for individuals, and the GTAP is for groups. I'm mentioning it because this one is a specific technique that was created for trauma-focused. So something that has happened within, you can do it few days before the event, after the event, and up to a year after the event. And within 2 to 4 sessions, people can normally feel significantly better. And what it means is that you help the person process the trauma and heal from the trauma right away without it being stored in a non-adaptive manner that will definitely affect you for the rest of your life after. So it's like catching it before your brain took the time to process all the information and store it in. It's catching it in the early stages, so we can definitely make a significant effect to the plasticity of the brain. And it works really amazing. I started using it myself recently, and I see the benefits of it. So it's very, very useful technique. Trauma incident reduction. Would you like to explain a little bit about trauma incident reduction, maybe?
Okay, trauma incident reduction of TIR does the same. So the idea is like discharge any unwanted feelings, any negative charge from the memory. Okay, but in this case, what this technique does is that have the client, it's a whole protocol. So EMDR and TIR is a protocol. Okay, both are evidence-based. In this case, EMDR is one of the techniques that has been more research on that. So in this case, TIR, what does is that have the client go through the incident from the beginning to the end, and have the client, in this case, we call the client viewer. okay? Just to see the incident. So imagine when we have something bad happen to us, all that memories, all the incidents inside our brain. So let's see that. Can I read what is in this page if I have everything here? No. So what TIR does is like give the client the chance, the opportunity just to review the incident. So rather than being here, is here. And by reviewing the incident from the beginning through the end, start to make connections of whatever happening, connected to unwanted feelings, sensation, attitude, pains, and also decisions that were made at the moment of the incident. Remember that we talk about when we are in danger, the rational part of the brain get hijacked. Okay, we are not aware of that. We are not conscious. So there are times that we make decisions when we are in danger. Okay, so through that process, we are able to connect things that in this moment are not adaptive, and we are able just to let go any feeling, sensation, attitude, or pain connected with the memory or the incident.
So go ahead and start covering what can we do for your child in order to.
Okay, how we are, is Anna, you online?
Yep, I'm here.
Okay, good. How we are about the time? Should we have some questions? Do we have time?
Yeah, we do. I think so. So, yeah, if you guys have any questions, feel free to type them in the chat box. Yep. Yeah, and however you guys want to do it. We got time. I don't see any yet, and you guys can also steal the microphone if you want it, but we'll come back to more questions too. So again, guys, feel free to type in the chat box if they're talking. I can interrupt them. Don't tell them I said that, and ask those questions for you if you guys have them.
Okay, beautiful, beautiful. So far we have talked about the aftermath of the trauma, the symptoms and what happens, techniques that can be in therapy by a clinician, licensed clinician in this case. And now you as a parent, what you can do, how you can help your child to go with. And I want to stress, and I feel that it's not a way to stress enough, how important is you as a parent be comfortable with yourself. Be comfortable with what is happening. And if you feel that you are not able to do it, you need to get help for yourself. Because we cannot give what we don't have, okay? And I see this so many times when I am treating families that the parents want the client to be relaxed, to communicate, to be organized. And then it's the parent that have communication problems, miss appointment, lose the keys. So everything starts with yourself, okay? So in this session, we are just going to go over things that you can do for your kids. But please be aware that if you need to work, some of them kind of guilty, okay? Self-awareness and work on that yourself, okay? So the first thing that you can do is like spend time with your child. Having that opportunity to having that conversation, okay? Ask open questions, okay? Don't, okay, are you okay? We were talking about that, okay? Rather than, are you okay? How you doing? Are you happy? Just ask them. How can I support you? What can I do for you now, son? Okay? Let them know that maybe you don't understand what is happening. Okay? Be open. As a parent, you don't have to be perfect. And letting know and telling them that, hey, I have no idea what I'm doing. I'm just trying to help you. Help me to help you. That open communication, we can use that incident or whatever that happened as an opportunity to close, to build that bonding in the relationship. Okay?
And I want to piggyback on that in the sense that I had a few people that I spoke to after some incidents that happened, as we all know, with the Parkland tragedy. And some of the parents, it's exactly what they told me, that they are asking, yeah, I've asked my child if they're okay. And I said, that's great that you're asking them if they're okay. However, to make it a little bit even more helpful, the open-ended questions are a huge tool for you as a parent, and asking, how are you feeling? What are you feeling? Just being able to discuss whatever it is that is going on. And I think that what Irene mentioned as far as saying, like, I'm not really sure how to help, but I am here to help. So we'll figure it out together.
Figure it out together.
Yeah, we'll figure it out together. We are a team. We're in this together. I saw some people trying to say, "Oh, don't worry, it's gonna be okay. It's, you know, it's over."
Yeah.
That's a big no-no for aftermath of a trauma, because again, people perceive situation differently. One child may be completely okay. Another one may feel very overwhelmed and very struggle significantly. And if they're going to see another person okay, and then their parent is going to say, oh, it's going to be okay, so why am I not okay?
Exactly.
What is going on? What's wrong with me? And the whole purpose of taking care of people after a trauma is the fact that it's okay to feel whatever it is that you're feeling, because it's normal, and it's you know, it's your place to do that, and we're here to help you with that. And it's definitely very important that the parent takes care of themselves. If your next slide talks about self-care, the parent self-care and making sure you're okay. So.
Yeah, and it's again, if we go back to the analogy of the wound, okay, if I have a cut here and I'm bleeding, and I don't take care of this wound, what is going to happen if I go to places? I'm going to infect other people, and my wound is going to get worse. Okay, so in that sense, the emotional pain is the same. Okay, so when we have wounds that hasn't been healed or they are activated, we then react. Okay, so it's the same. So offer them support, what you can do for them. Get help for yourself, and find time for these conversations. And it's so hard in this kind of social media time that we are always kind of disconnected. Find time. What is the best time? Maybe at dinner, maybe driving to the school, maybe Sunday night. You have to make time, and this applies not only after something traumatic happened. If we go back one to one of those bullets, apply for everything. So when we were working on this, this is not only for trauma survivor. This applies for everybody. This is really good ways to be parents, good parenting.
Yes.
So promoting your self-care. What your child likes to do, try to encourage them. Maybe they like to write, maybe paint, listening to music. And the best way to know what works is how your child behaves after. Okay, so it's listening like loud music. Okay, after they are like, oh, and you are like, whoa, I don't like that. But helps them, validate that. Okay, write it, or maybe like taking some time out, be in the room by themselves. Okay, silence, validate that. And you were mentioning about how we react different ways. Be aware of, or try to avoid compare siblings.
Right.
Okay, maybe it was a family was affected by some event. In this case, we were talking about the school. We all react different, so please avoid compare one sibling with another. Perhaps why you are doing this if your brother
or your
survive, or your friend, what you cannot be like so and so. Okay, that is actually what you are doing, is re-dramatize. Okay, putting more charge on whatever is happening already.
Right,
okay, so be aware of that.
Like even the simple comments such as, I saw that Jennifer is really doing well.
Yeah.
I wonder what's going on with her. She seems totally fine. What's going on with you? So that it was a simple comment that we didn't mean to make our child feel bad, but by doing that right away, it makes them look at themselves like, is something wrong with me? So I think that's
absolutely. And that goes back with the next one. That is, no, we are talking about physical touch. Maybe hugging. Okay, ask the client, ask your child if they want to be held, and ask. Okay, it's very important because sometimes we just want to be by ourselves. Okay, and we go back to the first one. It's like, how can I support you? What can I do? And sometimes we don't have even to touch. It's just to be present. Okay, and remember that we don't have to fix anything because it's not that easy. They are not broken. Okay, they are just reacting, responding to what happened. So don't feel that you have to fix anything. So sometimes just maybe your presence, and as we started the webinar, just still, just here. Okay, is sometimes is enough. Help your client, your child to be safe. And when I teach my trainings in trauma, safe is relative. Okay, so we have different ways to feel safe. Okay, so just ask your child, how can I help you? What can I do to make you feel better? Okay, maybe is, as I mentioned, silence. Avoid TV programs, news, all of that is not needed. It's not useful. I don't know why we watch TV. It's not useful. It's just adding more things. Okay,
and we know that that's a little difficult with Facebook and social media, and they, teens today definitely are very, they have accessibility to everything, probably even better than us, not probably, for sure, better than us. So it's hard to limit that. But especially if your child mentions, oh my God, I saw this on TV, or I saw this on that, you may just say, I thought that maybe it'll be a good idea to maybe limit a little bit of the time because it seems like it's creating some kind of a reaction.
Or having that conversation. How do you feel after you watch that? Okay, and help them to get to their own conclusion as well. Because if your child is a teen, if you say don't do it, what they are going to do? They are going to do it. Okay, so having that conversation, using that moment as a teaching moment.
Right, I saw that this is how you reacted to it. I think it'll be a good idea for you. You do whatever you want. So this is a choice for you. Do you prefer being on social media and having all this negative reminders and emotions coming out of this? Or do you prefer disconnecting for a little bit, not deleting your profiles or anything, just maybe putting it on hold for just a little bit or minimizing the amount of time you're there? So it's more of a choice between what you want and what you don't want, and it's fine with me. So not to push it to, this is what I want you to do, or give me your phone, or this completely disconnecting them from their social media work, because I think it's very important with teens nowadays that parents understand the role of social media for them and how it's life-threatening almost for them, in the sense of, oh my God, if I'm not going to have this, I'm not going to be connected to my friends. And a lot of the times they're going to be feeling very connected to their friends, especially in the recent, what happened, they all experience it together. So they have that as a common ground, and they feel like their peer may understand them better than anybody else. So take that into consideration.
Absolutely, absolutely. Maintaining, and that goes as well, with maintaining expectation and rules. Okay, and we were talking at the beginning how they may start to acting out, getting angry, and seems oppositional. The rules of the house must stay. That doesn't change. Okay, so don't feel that if you say no, it's going to get worse. You have to stay with the rules and explain the expectations that you have from that child. And we go back again with the communication. Okay, we have to have that communication open. Addressing the acting out behaviors. Be aware that they may be some risk behaviors, so kind of pay attention to that, and that must be addressed. Must be addressed. If you see like self-harming behavior, increasing on alcohol use, that they shouldn't be drinking alcohol, driving, careless, cutting behavior, those are really, really like red flags that you must seek professional behavior, professional help. Also, when I see clients, I pay attention how they are behaving at home, but also how they're behaving at school. So if you see kind of the client is your child is acting out at home, but also at school, that also is a red flag that we need to get some help for them. Okay, and I think that We talked already about the next one.
Yeah.
Okay, the social media, the importance, and I think that we have to be kind of fair to social media, because I found so many good things in Facebook, YouTube, online. So it's just how we use it. It's nothing wrong with that. It's how we use the communication, the social media that we have. Okay, so be patient.
Take a deep breath.
Take a deep breath. Okay. And again, be patient with them, but also with yourself, okay? I teach my clients just you have something you have just to help yourself, okay? And like, it's going to be okay, even though it doesn't feel like, okay? Because it's a process. It's a process. So when something bad happened, a trauma happened, we not only have to work with life, because life continues. Okay, life continues, but also we have to deal with something else. So we have to be kind to ourselves, and we have to say, hey, it's okay. It's okay, you are struggling, but this is going to pass, even though it doesn't feel like to. And again, if you feel that you as a parent cannot cope with, get help for that. Okay, the next one, we okay with the time?
Yes.
Okay, the triggers. Okay, remember this part of the brain. Okay, remember that the logic, we don't think. When we are stressed, we don't think. Why? Because this part, the amygdala, getting control. Okay, we are just fighting or trying to avoid whatever is happening. We feel in danger. In danger. So we have to be aware of people, places, things, sounds, sensations, smells, anything that could be connected with a traumatic memory that may trigger. Okay, so maybe it's not like he's just depressed because he's depressed, it's oppositional because it's just oppositional. It's because something happened that is like beneath of the behavior. Okay, so be aware of that. Changes on relationships as well. Okay, so any dramatic change, behavior, relationship, maybe your child was more like talkative, and now it's like withdraw, or reverse, it was more like withdrawn. All of that is very important. Addressing the attitudes, expectations. It's common that when something bad happens, and I see that so many times, it's so sad during therapy, that they are just expecting the worst. Okay, what I'm going to make plans? What is the point to do this if this is going to happen? And I just see it last week. What are going to think positive? What are going to get hope? If every time that I make hope something good, something bad happens. Okay, so that statement is very common with trauma related, because they are just making connections, and that is irrational. That is not adaptive. Okay, so they are just thinking about, if I think positive, something bad happened. Okay, so that is something also that we have to address.
Which
Yes.
We can touch on that whole, could be survivor guilt that maybe people may feel.
Absolutely.
If somebody else died, oh, maybe if I could have done this, coulda, shoulda, woulda. All those are definitely something that happens for a lot of people after a traumatic event, and may have some feelings about, oh, I may feel responsible for the death, or just I could have done something better. And a lot of the work that happens after a trauma relates to that issue of realizing that you did the best you could with what you had. We need to, a lot of times there's a disconnect between what we know and what we feel, and that's what both TIR and EMDR can help with. When a person has a disconnect between, I know there was nothing I can do to, let's say, back to the incident of the car accident that, God forbid, Irene and I had. Let's say that day I invited Irene. We weren't planning on seeing each other that day, and I invited her to come out, and something actually did happen. And God forbid, she even just got injured. I may feel, maybe if I didn't call her to come hang out with me today, she wouldn't have gotten injured. This is all my fault. So even so, I know this, it's not my fault. She could have said no. She could have had other plans. Maybe she would have driven herself and somebody would have hit her anyway. We don't know. But I feel I know this, but I feel if she didn't come out with me, nothing would have happened. And no matter how much I try to convince myself to feel that this is not my fault, I may feel it's my fault because this is the way the trauma got stored in my brain. And that's a very good example as to why treatment is necessary, because we can help the person make the connection between what they know and what you feel, the rationale that is happening that makes sense to how our body perceived what happened to us.
Absolutely. And that is the gap that we were talking before, okay? Because at the time of the trauma, the rational part gets frozen, okay? Everything gets stored here, so we cannot make that connections. And that kind of irrational thinking, maladaptive thinking, belief is unconscious. We are not aware of. Because of that, we kind of fantasize the importance of trauma therapy. It's different than the regular talk therapy. It's totally different. Talking about the event won't be enough in some cases, okay? Some cases. So there are times that we just need to target that memory, that sensation through a specific techniques. Okay, so it's not the therapist, it's not the father, it's not the guardian that is taking, oh no, it's not your fault, it's not their fault, because it doesn't matter how many times you said it, it's not here yet. Okay, so it's the person that experienced the traumatic event that need to make that connection.
And I'm pretty sure anybody who's listening to us right now or is going to listen to this later, right away can think about a time in their life where they feel like, even so I knew this, I can't disconnect from that feeling. Exactly. That, going back to defining a trauma, that's a traumatic memory for you. Whatever memory that came to your head when we were talking about this experience, this is what a trauma is for you. This is something that if you want to change how you feel about it, you should go see a trauma therapist because it can help you work on those issues through special techniques for trauma help.
Absolutely. And then that is the next bullet, seek professional help. Okay, and we add that, but also think about the support system. Okay, sometimes we just need to spend time with the family, with friends, connecting with ourselves, the things that we like to do, singing, writing, and that is the expressive arts, things that we were disconnected that help us to feel. Okay, because sometimes it's like so disconnection with the feeling.
Right, and it's a little bit of kind of like take your body, your mind will follow. A lot of the times you'll hear your child saying, I really don't feel like going to do this. But if you see they're debating, just try to encourage. Just try to say, oh, maybe if when you get there, you'll feel better. Why don't you try? Worst case scenario, you can just come back home. I think it would be a good idea to try. Just have them definitely try those things, even if they don't feel like it. If they're debating, try to encourage them to do it because they may really feel different after.
And even more, do it with them.
Right.
Do it with them. And I see that so many times in therapy. No, he doesn't want to be in therapy. No, he has to be in therapy. Guess what? That child is the identified patient because it's the system that needs help. So use this process as a family growth opportunity. So yeah, everything starts from you as a parent, okay? So don't say it, just do it. Walk the walk with them, okay? Because you are together in this.
Okay. Well, actually, before we go to this,
I think that do we have questions there, Anne?
Oh, yes.
We actually do have a couple questions. Let's see here. They relate a little bit back to EMDR when you guys were speaking about EMDR. Somebody asked, how do you assess the readiness for EMDR?
Oh, beautiful, beautiful. Can be administered. Yes, it can be administered after done.
How do you assess the readiness? So there's
the readiness. Okay,
right?
So the client EMDR is not the dual stimulation. It's the whole protocol. It's the 8 steps, phases that we call. Okay, so the first phase is the assessment. Okay, so the client have to be stable enough to deal with sensation, okay? Because one of the common activators, the ingredient, active ingredient in trauma therapy is that the client may feel the same sensation that is experienced during the moment of trauma, the moment of the incident. So the client have to be stable enough to deal with that process, okay? The client have to be willing to work on that, okay? You cannot force anybody to do actually any kind of therapy. So in this case, it's a no. The person have to be willing, have to be stable, willing. Yeah, I think that is the main thing, but the most important.
But going back to the specific question, as far as how do we know we're ready, the second phase of the MDR is resource development.
Yeah, to be ready.
We are making sure that there are some techniques which we're going to go over in a few slides as well. We're going to teach the client some grounding techniques, a safe place, containment. Irene is going to elaborate on all those down the presentation. All those are very significant. We make sure that the client has the ability to go from high stimulus and high anxiety, high stress, to feeling grounded, relaxed, and more in control. We're going to do a lot of exercises like that until we feel like, okay, we give the client a toolbox, they have that to use, and now they can move forward. As to specifically recent trauma, so I saw the question that said about RTEP. It's important to understand that RTEP, which is, the RTEP is the one for the individual, and the DTEP is the one for the RTEP is specifically for a recent trauma that happened, so it can be done soon after the trauma, and then up to a year after the trauma happened. And it is for the purpose of the fact that it's still not stored in the brain, it's still fragmented, and we're trying to catch it before. So the RTEP protocol is a little bit shorter because we don't have all the time of going back to history. There's just a very basic history collection. We're just going to ask a little bit of history of trauma, any other traumas that you've had in your life, who is in your support system, and then normally there is a specific exercise that is called the 4-element. There's a resource exercise. There's a few very specific exercises, and we use, which I think you're going to talk about, we're going to talk a little bit about the butterfly hugs or the butterfly taps. There's tapping of all kinds that you're going to teach the client first, and then you go right into the processing. And with what's different between the EMDR standard protocol and the RTEP or GTEP protocol, that they stay more within EMD, and EMD maybe little R. So we're trying to stay focused on the specific incident that happened. We're not allowing ourselves to reprocess old memories. If the client starts to go back to other things that are not related to the most recent trauma that happened, we redirect them back to talk about the most recent event, the episode, whatever happened for that episode, and we go back. And the same is done with the groups. It's done in a group setting, and I'm going to actually talk about it a little bit toward the end because we're going to offer that as a service for the people who are survivors of the Parkland shooting. So I'll mention a little bit more about that. Does that answer your question, Judy?
Yes, that's good. Thanks. Sorry about that. That was wonderful. Thank you.
Good. Okay. So if you have to get something from it, is that the technique, either TIR, EMDR, helps just to discharge any negative feeling, sensation connected with the incident. Okay, so the idea is that yes, the memory is going to be there because we don't erase memory. It's going to be there, but the negative charge is going to decrease. Okay, so we are going to decrease, or disappear in most cases, sometimes. So it's going to be able to continue living life in more adaptive way. That is the idea.
A very good way of like simplifying it is the fact that normally when we go through a happy memory, so again, I had fun with my kids yesterday, so I can tell you what happened. I'm not all of a sudden now like all jiggly and happy, and I'm having all the rush of emotions of happiness and excitement that I had yesterday. Most of the time with average happy memories, we just have the memory that there's not really a strong relationship of a feeling. With a negative event, however, our brain in magnificent ways, unfortunately, does have the emotional responses to the negative event. And when we think of something negative that happened to us, most of the time there's going to be a negative emotional charge attached to it. And through doing trauma work, we're just able to talk about what happened to us without it bothering us. So we assess with the client in the beginning, okay, from 0 to 10, how disturbing is this event to you? 10 being the most disturbing ever, 0 being not at all. It doesn't bother me at all. And you see the progress of doing this technique, and they may start in the higher ranges of like 8 to 10, and at the end of it, that's how we know that they actually went through the whole process, is when we ask them at the end, they will likely be at a 0, sometimes at a 1, which is still okay, and then we link it to the positive cognition. So if somebody starts with a negative cognition of, I should have done something, like we talked about before, then or it's my fault, and they want to get to the point that they are going to be able to talk about what happened and say, it was not my fault, or I did the best I could with what I had. So through the process, you actually assess as well the positive cognition. How true does this statement feels to you from 1 to 7? In the beginning, they normally are in the 1 to 3 range, meaning not at all. And then toward the end, they're going to get to the 7. That's the end result. I feel this is true. I did the best I could. This is not my fault. All this process helps them go through that whole roller coaster and then be able to detach the negative emotion and recognize the memory for what has happened and where are we today now without the negative thoughts and emotions that were linked to it before.
Absolutely.
Okay, let's talk about some skills.
Okay, so this is like trauma-informed stabilization techniques or activity. And if we follow the EMDR protocol, we can use this on the preparation stage, okay, but also at the end of the session, okay? And we pick, this is the continue? Okay, so this is kind of things that we can do. And this is just the name or the things that we can do. We don't have time to go one by one, but just practicing basic awareness, okay? Mindfulness, that is now in the mainstream right now. Be present in this moment without judgment. Any grounding techniques, okay? I've been practicing, I don't know, guys, and if you can see this, anything that make you feel here and now. And this is something that when I'm doing therapy with my clients, I try to keep this in my hands, okay? Because we are, as a clinician, we receive, okay? And we call that vicarious trauma, okay? Because we are listening all the time stories. So one way that I try to kind of self-regulate myself while I'm working with my client is just keeping something like this, or even smaller, regular stones, regular like pebbles, okay, in my hands. And this gives me like, I'm here, okay, and just like practicing deep breath in, deep breath out, help me to keep grounded. Simple like this, okay? The basic breathing techniques. In my case, I tend to close my eyes even when I'm talking, okay? But give yourself a chance to see what works better for you. Maybe you can close your eyes, you leave it open, okay? And most important is find your own path, your own rhythm of breathing, okay? And sometimes that's so simple and it helps so much. Connect with your breath, okay? Exercising with muscle tensing, okay? Something that is very simple is like tense, feeling the tension, okay? And then little releasing, and you go back, tense, and just releasing, okay? What this helps is like bring that tension to the body, okay? Because sometimes we are disconnected. The mind is here and the body goes where, okay? But if we are aware of whatever is happening in our body here, we are able to self-regulate, okay? To pay attention to our body needs. Another technique is visualization. We can use containment, picture like a light in our body or going through us. The regular visualization that is
Guided
guided meditation that is very common, okay?
Yes.
So don't minimize the importance of those techniques, okay? It seems to be silly, but it is evidence-based that works, okay? Because something that I teach to my clients that our brain doesn't know what is real or not.
Right.
Because of that, we get so scary when we watch like scary movies, or we cry when we see a sad movie. It's because of that. Our brain doesn't know. So the same thing that works with the negative stuff also work with the positive. So why we don't use that power that is already in us? Okay, so just thinking about positive things helps yourself to self-regulate. Okay, and remember that we are just talking here about coping skills. Okay, thinking positive won't resolve the trauma. Okay, I'm not saying that, but it helps just to help yourself to self-regulate.
Right, because you're going to spend time with a therapist in the office in 45 to 50 minutes, maybe an hour and a half if you do EMDR or TIR. But the rest of the week, you're going to be on your own.
Exactly.
You're going to need all those extra tools in order to feel better and help yourself on your own. That's the purpose of all the other techniques that we're going to mention. Those are some of the techniques that you'll learn with a therapist in their office if they're going to do with you some trauma work. But those are all available also on YouTube, on podcasts, on many resources online. That if you just Google guided meditation or muscle tensing exercises, you can get a huge list of things. And I'm going to mention some resources at the end that you'll be able to use.
Yes. Identify things that you enjoy. We call that recovery capital. Okay, things that are already in yourself, hobbies, support system. We were talking about faith, music, activities of social walking. We were talking about EMDR. EMDR just like dual stimulation, okay, tapping, but also walking.
Right.
Is dual stimulation, okay, because of that is so common that we feel relaxed after the walk, okay, because it's the right, left. Drumming, okay, but I have drums, okay, all of that helps.
Anything that causes bilateral stimulation.
The stress balls, okay, in this case I have the stones, but you can, the stress ball right, left helps, okay, things like this. Just bouncing side to side helps. Support groups, community activities, petting your dog, your pets. I have here a pet, I have my cat, and I have a little turtle. Okay, I just talk with them, and that helps me to feel better. Okay, like making that connection with the here and now. That is so important. Okay. So this one is an exercise, the name is container. And this exercise is common when we are working with EMDR. Actually, this is one of the standard exercise that we teach to the clinicians so they can use it with the clients, okay? So the invitation is just to imagine just a container, okay? In this case happens that I have these little box. In this case, it has some kind of stamps. Okay, but you can imagine any box, any container, okay? Could be a Tupperware container, could be a box, could be a chips box, whatever container, okay?
A vault, safe.
Yeah, a bag, whatever. And just imagine that, okay? And picture you having that container in your hands. Again, this is something that I do. I just close my eyes and helps me to visualize. And just imagine the texture, how that feels, the weight, the color, and what you are imagining that box. Again, could be something real, could be something that you are just making up. Just hold that. And the idea is that any sensation, feeling, thought that doesn't help in this moment, anything that is not adaptive, okay? You just imagine yourself like opening the container, and putting those things that right now you can do nothing, because in this case we are here, okay? If I'm worried about my bills, about things that I have to do, I'm wasting my time, I'm wasting this moment. So the idea is that any time that you are going to start a new activity or finishing something, you can use the analogy of the container, just to put that in that container for now, seal that, put it away, and knowing that you are not avoiding whatever you just put in that box or container. You are not avoiding. You are just putting on the side, and you can come back to that anytime that you want. Mm-hmm. Anytime, it's there waiting for you if you want. Mm-hmm. Okay, so that the exercise is like putting that in a safe place so you can move on with whatever you are working with. Okay, so this is very like simple explanation on how the containment works. Mm-hmm. Okay. Do you practice the containment with your clients?
Yeah, I actually do it.
Experience, and then we move to this.
I actually do it with all my clients. All my clients, even those that don't do it anymore. Mm-hmm. I tell them this is an opportunity for them to leave things that they don't want to think about and they are very troublesome for them, and they can leave them in my office. So for them, when they do it, the container is left in my office. So part of the visualization exercise is you're putting everything in that box, and now you're giving it to me. So I have it, which means that the only time you can go back to think about those things are going to be back in my office. So sometimes clients, of course, say, does it mean that I'm not going to think about it? Of course it's going to pop in your head, but then you're going to say to your mind, I can't go there right now. I'm going to go back to there when I'm in Luna's office. I'm going to be able to access it then. And that gives them a little bit of a break, like, oh, I don't have to think about it now. I'll have the time to think about it. It's just not now. And clients say that it's so uplifting to just be able, they're actually, the first time after they do it and they come back the next week, they're like, it actually worked, because they're very surprised that it actually worked for them. So it's a very powerful exercise that you can do yourself. You can teach it to your children if you want. We just gave you the description of it. If anybody wants more information about it, please feel comfortable reaching out to us and let us know that you want more information about it. I'll be happy to do that. I'm sure Irene will do the same. And again, if they work with a trauma therapist, they're most likely going to get that exercise themselves. And the fact that you know about it is that you can remind them. If you know that it's something that they put in a box or anything like that, you can tell them, remember the box. Just a very subtle reminder to remind them that they can put it away for now. And it's very helpful.
Yeah, and even if the visualization is kind of too like far for you, like you are not able to do it, it's fine. You just kind of write down whatever is happening, bend the paper and put it in the envelope, and seal the envelope and put it away. Okay, so they are kind of adaptations as well. If the visualization you are not able to do it, so then write it down, put it on an envelope, seal it. Yes. Okay, and put it aside. Put it aside. Okay. Okay. So this one is the tree visualization, and this one you can do it like seated. In this case, we are seated. Okay. So just find a comfortable position. If you are standing up, also works. Okay. And the main goal is just to feel yourself grounded. So, as always, start with a deep breath in. And as you are making that connection with your breath, just try to notice the connection that you have with the ground below you. You may want, or you may need to take some moments here just to feel your feet on the floor. Okay, you may want to kind of bounce your feet side to side or maybe tapping, feeling that connection. And again, it's not right or wrong. You just notice whatever is happening. And as you continue making that connection, noticing, feeling the ground below you, imagine that they are roots, like a tree roots coming out of your fingers, of your foot. All the roots are expanding, allowing yourself to be more grounded. And just keep noticing. Something that I like to do is just adding some kind of movement to that, like side to side. Imagine that you are just responding to the wind, moving side to side. And to this, you can include like expanding your arms and moving side to side. Imagine that your arms are the branches of the tree. And you can find kind of a comfortable rhythm. You can keep moving side to side, or even like finding circle movement. Whatever feels comfortable to you. You can keep going as long as you need it. You feel that you are fine. Take a deep breath in. Again, keep noticing whatever is happening. When you feel that is enough, then you can open your eyes very slow. Imagine that this is the first time that you have your eyes closed. Bit of a leader. And then you can look around, practicing the same thing that we did at the beginning. Okay, just trying to look around, identify the object. I see here the frame, the light, the plant. Okay, and I always like kind of to stretch, because we are not aware, but we keep like holding a lot of tension through the day. Okay. And any tension that's still, let it out with a huge just allow yourself to melt that tension and shake it. Feel it. Good. Are we still here?
Are we still here?
Okay, I went kind of like through a journey.
Good.
Good.
The stretching
Okay,
part is my favorite. I love the stretching part.
Yes, 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 yes. And this is something that I do always with my clients. At the beginning, they are kind of shy, but then they do it and even shake it, shake it, shake it, shake it. And then you stop, and you can feel all the blood moving. Okay, and this is a good way just to be present. Because when you are feeling your body, you are not thinking. You are just feeling. Okay, and this is a very simple way to be mindful. Noticing without judgment, just noticing. Okay, and you can always keep stretching. Great.
So let's continue. I think here we just wanted to mention, and actually I'm going to pause on this and go back for a moment if that's okay with everybody.
Yes.
To mention, because we only focused on the EMDR and the TIR and the EMDR early techniques and even within EMDR, there are few other early intervention techniques that work very good for crisis, and they work for general traumas. But some techniques that I didn't mention that are also great are tapping, brain spotting, bio and neurofeedback, transcranial magnetic stimulation. Trauma focused CBT is for a little bit different situation, definitely not for something that was recent trauma, but for other type of trauma, it's a very good technique. There's the MNRI. There are many other techniques out there that are good for specifically some more significant traumas, and for recent traumas. Based on the research, there's a lot of research to support EMDR and TIR, and that's what we focus on those. But I definitely don't want to say that the techniques. And really, if something works for one person, it may not work for the other. So if they want to try something else to see if it works for them, that's great. What's the most important piece is that you find a qualified therapist. And the last slide that we're going to talk about after expressive arts is going to talk a little bit about that and giving you some skills as a parent on how do you find somebody, how do I know that this person is qualified to treat my child. And within expressive art techniques, Irene is going to elaborate, but we even talk about acupuncture, massage, aromatherapy, Reiki, yoga, play therapy, equine therapy, and what she's going to elaborate, and music therapy. All those are available. The Professionals United for Parkland group has a music therapy group that happens once a week, every Tuesday. I believe it's 8 o'clock at night. It's locally. That's happening free for the community to come. If anybody wants details about it, they can let me know. But there is a lot of resources. There are a lot of resources available for free right now for the survivors. So it's very important to also look into those, which I'm going to mention a little bit at the end. But Irene has a lot of experience with some expressive art techniques that she's going to share with you guys.
Good, thank you. Okay, so thinking about expressive art, think about anything that we may try as a child, and somehow we forget how much we like to dance, how much we like to draw, to sing. Okay, because someone told us, oh my God, you seem so awful, shut up, oh my God, but yeah. Or we have like for rhythm. So expressive arts therapy is kind of many modalities, included dance, movement, and we just experience how powerful could be just something so simple as stretching. This is a movement. Okay, but we forget that we need to move. Music, creating music, okay, something that I do here, and maybe because of that I feel so into these techniques, because it's something that I actually do in my daily life. When I'm stressed, I sing. I sing to my dog, to Laila, and if you ever know me, I have pictures of her everywhere, you know, Laila, and I just sing to her and make me feel happy. So when I'm like just making up lyrics inspired on my Laila, I'm not thinking about my problems, I'm not thinking about the things that I have to do, I'm just present in the moment, okay? Other technique is writing, journaling. Okay, and I've been practicing something and teaching to my clients. I don't know if you can see it, guys. And can you see it? I don't know if we can.
Yep, we can see it.
Okay, good. So this is just an example, and this is real. This is personal, okay? A journal, okay? In this case, I've been writing. I don't know if you can see kind of the writing. And after I write, then I just paint whatever I feel like, okay, and that moment, okay? So this is just an example how we can express whatever is happening in us without talking, okay? And this is something that we have to keep in mind when we are working with trauma survivors, okay? Because connected with trauma also is a lot of shame, guilt, it's a lot of I don't know what is happening. So how am I going to explain to you, okay? But if we have the chance just to write about that and put whatever is happening in image, it's very helpful, okay? And it's not explanation, it's just me and the medium, in this case, the book and the acrylics and the pictures. Okay, so this is a great technique as well in the umbrella of expressive arts. Photography, acting, role plays also is a great technique. Visual arts is the one that I just mentioned, show you guys, and visualization and meditation. Okay, because we are always so kind of on the rush all the time, we are not used to be quiet. Okay, and even if I just stay quiet, way before the minutes of my silence is going to be kind of an awkward moment because we are not used to. Okay, so we must make time just to quiet our mind. Okay, it's the only way. It's the only way that then we can make some space. Okay, just to noticing. And keep in mind that it's not right or wrong feelings. They are all the same. Okay, and when I used to work with my clients with history of drug use, okay, we feel it's because we are not high, we are sober. Okay, so whatever is happening here is all well. It's how we cope with that. Okay, I may feel really bad, angry, agitated, but I don't have to act out that. And because of that, is so important, these techniques. Okay, I want to run away, I want to cut myself, I want to get drunk, to do something that is self-harming. If I'm aware of that and I know the techniques, I can go back to what? To the things that really work for me because I have tried. Okay.
So we're gonna end with some resources for you, available resources for you, and then we'll leave some time for questions at the end. The Trauma Recovery Network is an international organization that has chapters all over the country, and they do missions to help after recent traumas. Recently, Brian Gong and Larry Schleifer activated the chapter here in South Florida. And what's good with the Trauma Recovery Network, it's a place for anybody who experienced trauma to find qualified professionals that are trauma professionals that have more than just EMDR as their training, meaning they didn't only get basic training for EMDR, and who knows how much experience they have in it, because many people can get trained and practice right away, but you need additional training in order to become a professional on the Trauma Recovery Network. I put the link on the presentation, so this way you guys can go there. But also, if you just Google Trauma Recovery Network Southeast Florida, you're going to have there an actual contact form. You can go ahead and contact them, and they're going to link you with a professional who can help. And this is very much right now focused for the people who are survivors for the Parkland shooting. So anybody who needs services, a good place to start would be the Trauma Recovery Network. Brian is very responsive. He'll be able to link you with some free services. Basically, the rule for the Trauma Recovery Network is that you get up to 5 1.5 sessions for free. And as I mentioned before, the RTAP protocol takes about 2 to 4 sessions. So the idea of doing 5 is to make sure that whatever you came in to work on is taken care of, and it's resolved before you leave. The other resource we put on there is the Professional United for Parkland group that is actually in the stages of becoming a nonprofit organization. It's a group of professionals that started, and Melissa Kornholtz was the one who created the Facebook group, and within no time we had, between the FCA list that was generated and the American Family and Marriage Counseling group that was created their own group, and Les Gordon, who created another group, all of us collected together over 300 professionals on one list that are willing to help and ready to go with whatever it is that needed. And there is that hotline number that also is a good resource for you to go there. The next is Health Journeys. Health Journeys is an online platform to you to buy normally guided meditations and visualization exercises. They're an amazing research location, and they actually, due to the tragedy that happened, they donated to us a page. It's called Parkland Strong, and the link is on the presentation, but anybody who was in on this presentation or signed up, we will email you the link directly, and we're going to post it on social medias as well to make sure it's available. It's really amazing. I highly encourage anybody here, even just people that you know that are struggling with being grounded, to visit that page. It's full with resources. I would focus on the top resources in the beginning, just getting grounded and self-soothe and the sleep. The more intensive, there's like 3 at the end of working through trauma and grief that I would wait a little bit more time probably to access, but definitely it's a great resource, and I'm really grateful for Health Journeys that they donated that page. We're gonna do an EMDR RTEP parent group. It's going to be on April 15 between 12 and 2. We're going to let you know it's going to be a local location. Depending on how many people register, we may even do it more than one time, but that will be available for you. So any parents that feel like the trauma of everything that happened that day, how are they feeling after, how are they feeling about supporting their children, having to be strong for your children sometimes, and being the role model. It's a lot of stress, there's a lot of trauma there. So we'll be able to help you, guide you through the RTEP protocol, which is really helpful, and will really change everything for you as far as the emotional relationship to what happened. Trauma Made Simple is a great book and a resource that you can find online as well. And we added the link for the National Child Traumatic Stress Network. We added a specific link about how to help teens with traumatic grief. But if you haven't visited that page, there's awesome. So much information available there that you can kind of like navigate through the page and get a lot of support on what to do, what not to do, and how to get help. So that could be a really great resource for you guys as well. And anything you want to add?
I think that we covered.
Yeah. Okay. Any questions?
You guys are amazing. Thank you so much for all this information. My mind is blown and it is full, and I'm really appreciative. You guys, while you're typing in maybe some questions in the chat box, I'm going to put a little survey that if you guys have time, if you would respond, let us know how helpful this survey was for you, and importantly too, like how we can bring you other presentations, what you need from the Florida Counseling Association and amazing professionals like these two we have right here. We just want to be able to support our community. So again, feel free to type questions, and I'm sure these two will hang out for a minute or two. And we so appreciate their time on this beautiful Sunday. I can't believe it's Sunday already.
Yes.
Well, it doesn't look like there's any other questions, but lots of thank yous. And if anybody has any questions or needs to get a hold of these two, again, we will send up a follow-up email with the resources. I hope that's okay, you guys, and their contact information. So if you have any questions, we will direct you guys their way. So thank you again, Irene. Thank you again, Luna. We are so appreciative of your time today. Thanks, guys.
Thank you. Thank you. Take care.
All right. Thanks, everybody. Have a wonderful day. Talk to you soon. Oh, wait, we got one. Is there a resource you can share which has information about different qualifications for trauma-trained therapists?
I can send you the link, but basically you have to have any kind of training on trauma. If you are interested to EMDR certified therapist, you can go to Andrea. That is
EMDRIA. That's the website for Andrea to find any professionals that are trained or certified.
Yes, certified. For TIR, you can go to TIR.org and ORG, and they have also the certified clinicians in this case.
What I can send to,
link.
I'll send I'll send it to you, Ann, and you can forward it to everybody with a follow-up email. I can send some explanation about some EMDR techniques that we mentioned, and some trauma techniques that we mentioned, in addition to some that I didn't cover but are good. I'm going to put it. There's a resource guide that we have generated, actually donated to us by the support team from the Sandy Hook's tragedy. Deb Delvashio actually gave it to us to share with everybody. So we'll be able to send that. As far as having specific information about qualification, I would just say, just like Irene said, make sure that the therapist is not just a licensed clinician, which I would definitely, that's a starting point.
That is the first.
For trauma, definitely a licensed clinician, somebody that has a little bit more experience than just a registered intern, even so I respect their job, and of course I was there once. All of us have been there before, but because trauma is a little bit more complex to work with, then it's recommended to work with a licensed clinician. But then even a licensed clinician, if they don't have training in trauma, it's going to be almost impossible for them to really help heal. They'll be able to help cope with symptoms, help you cope, but they're not going to be able to heal. The trauma techniques that are out there, in particular EMDR and TIR, and EMDR, early interventions, or just EMDR, depending on how much a person is available to work and what's their resources. All that is also important to look into, but making sure that the therapist you're going to work with has the additional training. They have to have additional training in trauma techniques. If they don't, they're probably not a good fit for this particular issue. And that's why the Trauma Recovery Network is a really good place to start with, because they already go through the process of vouching the professionals. They reach out to them as volunteers. They go through the process of verifying their education, verifying their training, and they'll be able to vouch for that. The Professionals United for Parkland also, they're a little bit, there's some people who are professionals for grief, professionals for trauma. Some of them are both. So they're also a very good resource to contact as well. If you don't want to contact Trauma Recovery Network, you can contact the hotline, and they'll be able to either direct you to the Trauma Recovery Network if they feel like that's what you need, and if not, possibly give you a phone number or contact information for somebody else who will be able to help. Just vouching for the fact that they have additional training, that's the most important thing. I hope that answers your question.
Awesome. Any other questions from anybody? I think we're good. Well, yep, we got a big thank you. Thank you to you guys. So thanks so much again, everybody, for coming. Again, we are not going anywhere. We are just a click or phone call away. So if you think of anything, you need anything at all, you just let us know. And again, we appreciate you coming to this webinar today. All right, you guys have a wonderful day. Take care.
Bye. Take care. Bye.